I'm Cassandra Belinsky for Investment Pitch Media. Thank you for joining us today. Relic Health Technologies, a rapidly growing global healthcare technology company developing innovative virtual care solutions for the multi-billion-dollar healthcare market, has signed 7 new contracts with physician practices and home health agencies in Nevada and Texas. Dr. Lisa Crossley, CEO, stated, "We continue to add new clients to the platform, particularly in the southern U.S. Due to large concentration of retirees in these states, there are millions of chronic disease patients in this region who can benefit from Relic's proactive, preventative approach to virtual care. We have also started onboarding patients with 20 skilled nursing facilities that belong to a previously disclosed new client, a large healthcare system with over 1,200 care settings across 7 states. The skilled nursing facilities patients will be using the iUGO Care Transitional Care Management, Remote Patient Monitoring, Chronic Care Management, and Behavioral Health Integration modules. With these first 20 facilities, the company expects to add more than 2,000 patients per month to the iUGO Care platform by the end of 2023 at an average revenue of $60 per patient for the first 30 days post-discharge and $65 per patient per month for every subsequent month at an expected 75% gross margin. When you consider these 20 facilities represent less than 2% of the 12,000 care centers included in this contract, imagine the full revenue potential from the other 1,180 facilities. We have some highlights from Dr. Crossley at Relic's latest investor webinar, where she provides an update on operations and the outlook for the balance of 2023.
Our outlook for 2023, I know I've said this before, but I think it bears repeating. So particularly for anyone who's new to the story, I want to just kind of remind everyone that the company's achieved 2 of the most challenging milestones for any startup, which we certainly were when we launched the company and started working with clients and patients in 2017, 2018. And so we've been able to go from 0 to $1 million in revenue, and then from 1 million to 10 million. Last year, we did over 12 million in revenue last calendar year. So these 2 phases of growth are really transformative for companies. They require dramatic changes to operations, and they test every assumption in the business model. And as you've seen, some of those assumptions we realized were not entirely valid and therefore needed to be adjusted. So we've demonstrated, I think, as a company, our ability to learn and adapt during some of these really challenging phases where growth is accelerating tremendously and your business model's assumptions are really trial by fire, very much tested. So we've been able to adapt, and I think as a result, we're seeing some really significant changes in terms of some of the key metrics like adherence and collections. And as a result, I think we've set ourselves up very nicely to have a really breakout year this calendar year. And again, just to reiterate, at this point, many of our sales and many of our new clients come to us through referrals from existing customers. So we clearly have a product that works, and we will start to share some of those testimonials in future webinars. We've gotten a lot of wonderful testimonials from our clients. We generally use those with other prospective clients. So for the most part, testimonials are used really in business development. So they're not on our website, which is more investor facing, but they are used very extensively in our business development and sales process to get new clients on board when they start the due diligence process. So if we get an inbound lead, they often want to hear not just from the friend that they've heard from, but see some other testimonials from other clients who are using the product and maybe make contact with some of those clients. And so having those testimonials is really instrumental to the business, and we certainly have a lot of them. And a lot of our clients have really been amazing advocates for us, talking to prospective customers during the due diligence phase, which has really helped us get to this point where our sales have really become kind of autocatalytic. And we're certainly attracting a much larger scale client than we did when we started out in 2017 and 2018, which is it's kind of a standard metric in healthcare. If you are going to be a successful company, you need to see that evolution from starting with individual physician practices or home health agencies or other smaller customers into the larger customers and gaining credibility there. So it's a very good sign for us that we've achieved that milestone and we have that credibility with those larger, more mature organizations. Our outlook financially for 2023, we do not need to raise capital or take on debt to fund operations. So we get a lot of questions about either taking on debt or capital. And I think I addressed that in a little bit more detail when we get into the shareholder FAQs, but that's not part of the plan. And we still expect to uplist to the NASDAQ in the second half of 2023. So we are working hard to achieve the revenue milestones and certainly the adherence and collection milestones. And that will allow us to proceed with that. And I think significant change for the company, but a very positive change, future change. And we still expect to initiate a share buyback program in 2023. And as evidenced by the contracts that we've announced with that large physician network in Florida, the 3 skilled nursing facility networks that are in Florida, California, and Pennsylvania, and the large healthcare system that we've announced, we are clearly now able to attract those larger clients. They have not only significant revenue potential, but also because they're more mature organizations, they tend to make collections a little bit easier. And they also help out a lot with the adherence piece. So that's a very positive change for us. And we expect our traction with the larger clients to continue to accelerate in 2023 and beyond.
Based in Hamilton, Ontario, with offices in Florida and Texas, Reliq specializes in developing innovative virtual care solutions for the multi-billion-dollar healthcare market. The company's powerful iUGO Care platform for care coordination and home health care integrates wearables, sensors, voice technology with intuitive mobile apps and desktop software for patients, families, clinicians, and healthcare administrators, allowing complex patients to receive high-quality care at home, improving health outcomes, enhancing the quality of life for patients and families, and reducing the cost of care delivery. iUGO Care provides real-time access to remote patient monitoring data, allowing for timely interventions by the care team to prevent costly hospital readmissions and emergency room visits. The shares are trading at 53 cents. For more information, please visit the company's website, reliqhealth.com, or email ir@reliqhealth.com. Investor relations in the United States is handled by Ben Shamsian of Lytham Partners, who can be reached at 649-829-9701 or by email at shamsian@lythampartners.com. I'm Cassandra Belinsky for Investment Pitch Media.